we're talking about AS, we're talking about inflammation of the spine. So it goes without saying that one of the most common symptoms, or in fact, the key symptom for diagnosing ankylosing spondylitis would be back pain, or specifically inflammatory back pain. When we talk about inflammatory back pain, we actually look out for certain features that differentiate it from, mechanical pain or pain from wear and tear. And generally, we look out for certain features such as onset at a young age, before the age of 40 years, obviously without any injuries, ideally. A gradual onset, so not sudden over a few days, but in fact, a gradual over weeks or months, usually at least 3 months. Improvement of the pain with exercise, lack of improvement with rest. And finally, we also note that a lot of these patients actually report that they have pain at night, or in fact, early morning. Sometimes they get woken up by the pain, and the pain tends to get better in the mornings when they wake up and move about. They also may have inflammatory gluteal or buttock pain, and this may affect one or both sides. Depending on the extent of involvement, there may be loss of range of movement. And nowadays, in the era of modern medicine, we should not be seeing deformities like this, which tend to occur in late presentation. There are also involvement of other places aside from the spine, so the heels, the eyes, and other organs, potentially. We do see involvement of other joints, so some of the joints would be the knees, the ankles, as I mentioned earlier on, the enthesis. So the back of the heel, you can see the difference quite a fair bit between the inflamed side and non-inflamed side. You also notice what we call extra-articular, meaning areas of involvement outside of the joint. And this may include things like the eyes, what we call uveitis, the skin, psoriasis, or even the gut or intestines. Other rare complications may include that of the heart. So there can be inflammation of some of the large blood vessels or involvement of some of the heart valves. There could also be what we call fibrosis or scarring of the lungs as a result of ankylosing spondylitis.